Hi, back with the Healing Hunnies, Christie and Maggie.
We're going to talk to you about the lung, large intestine, stomach, and spleen meridians.
These are the first 4 meridians of the chi flow and the first 4 of the 24-hour organ clock.
The internal pathway of the lung meridian begins in the middle jiao and descends to the large intestine. It then ascends through the stomach, diaphragm, lungs, and throat, and emerges at lung 1 below the clavicle.
The external pathway starts 6 sun from the midline in the first intercostal space, then travels slightly upward to lung 2, then down the medial aspect of the arm, on the radial side of the biceps tendon, through the cubital crease to the radial side of the base of the thumbnail, ending at lung 11.
There is a second internal branch that flows from lung 7 to the tip of the index finger to connect with the beginning of the large intestine meridian. It's paired organ. The lung meridian is a yin meridian. It is paired with the large intestine meridian, and it is of the metal element. It provides Wei Qi and houses the corporal soul, or the Po. It governs skin and body hair, and it descends and disperses fluids around the body. It's used for grief and sadness, productive cough, and constipation.
Lung 10 is found along the fish border at the midpoint of the first metacarpal bone. It helps with dry cough, fever, clearing lung heat, promotes the descending of lung qi, benefits the throat, calms the mind, and enriches yin, just to name a few. The large intestine meridian starts on the radial side of the base of the index fingernail, through the first and second metacarpal bones, along the anterolateral edge of the forearm and biceps to the shoulder joint. It then flows to the trapezius muscle, then anteriorly through the muscle to just above the clavicle. It then travels up the neck to the opposite side of the nose, ending at the nasolabial groove at large intestine 20.
There is an internal branch from large intestine 16 to Du 14 where all yang meridians converge. A second internal branch descends from the clavicle through the lung and breast, through the large intestine, and down to the leg to stomach 37.
The large intestine meridian is yang, and it is paired with the lung meridian. It is also a metal element, and it is part of the cleansing and processing functions of the body. It regulates the lungs and also the final reabsorption of body fluids. It is used for the treatment of external heat pathogens, lower jaw and upper lip paralysis, intestinal inflammation, and some musculoskeletal problems and issues of the upper arm, such as tennis elbow.
Large intestine 4. It's located between the thumb and index finger at the midpoint of the second metacarpal bone. It's the imperial point for pain and inflammation. It's often paired with liver 3 to relax the body, clear excess, and move stagnation.
The stomach meridian begins externally, below the pupil, down around the mouth, up the jaw to the cat ears, or stomach 8. From the jaw, it runs down the SCM to the clavicular fossa. It moves out across the clavicle, runs down the chest, then moves inward to run down the abdomen. Then it runs down the anterolateral aspect of the thigh, side of patella, down the anterior aspect of the lower leg and foot, ending at the lateral corner of the second toenail bed.
There is a short internal branch connecting stomach 8 to Du 24. A second short branch leaves the clavicle to meet at Du 14 with the other yang meridians. An internal pathway begins at stomach 12 and goes to the stomach, spleen, and Ren meridian and reconnects at stomach 30. Another branch leaves stomach 36 and travels to the third toe on the lateral side. The final internal branch begins at stomach 42 and travels to the big toe on the medial side to connect to the spleen meridian.
The stomach is a yang organ that is paired with its yin organ, the spleen. The spleen and stomach are both earth elements, and together they take charge of food storage and from whom the 5 flavors are derived. The stomach controls receiving. It receives ingested food and drink and also holds them down by controlling descending qi. Then the stomach controls the rotting and ripening of food, then controls transportation of food essences. The stomach meridian is the second largest meridian, covering the upper, middle, and lower jiaos. It is used for a wide range of imbalances. Some include facial paralysis, headaches, hypertension, and uterine issues.
Stomach 35. It's located in the depression on the lower edge of the patella, lateral to the patellar ligament. This point is indicated for swelling and pain in the knee joint.
The spleen meridian begins externally. It starts at the medial aspect of the big toe. It travels upwards, passing the anterior aspect of the medial malleolus. Then it flows up the posterior aspect of the tibia, passing the knee, thigh, groin, and entering the abdomen. It then traverses laterally up the chest and then down to the 6th intercostal space, ending at spleen 21.
At spleen 13, an internal pathway connects the spleen meridian to the Ren meridian. At spleen 15, a second internal branch travels to the stomach and spleen and penetrates through the diaphragm up to the esophagus and under the tongue. The spleen meridian is a yin meridian. It's paired with the stomach meridian and is of the earth element. It transforms and transports food essences, qi, and fluids. It is the most vital organ as it generates both blood and qi. It also controls the health of the muscles of the body and lifts qi. It can be used to treat chronic fatigue, depression, excessive bruising, and digestive issues such as bloating and diarrhea.
Spleen 6 is located 3 sun above the medial malleolus. It is a 3-yin meeting point, liver, spleen, and kidney. It regulates all yin functions of the body. And that is why it is one of the most important acupoints on the body. Thanks for watching Meridians Matter with your Healing Hunnies, Christie and Maggie. We'll see you next time.